Well, with Medicare's annual election period beginning soon, the effects of the COVID-19 pandemic may have many of you rethinking or looking to adjust your plans. Well, our next guest says now is the important time to remind you to review those healthcare plans and make all of those changes now. Joining us this morning, we have Ben Brock of OptumCare, along with Dr. Tara Ostrom. She's the Associate Medical Director with OptumCare Primary Care. And welcome to the both of you. And Ben, I really want to start with you. What is the open enrollment window for Medicare?
Yeah, thanks so much. The open enrollment window is a once-a-year opportunity for millions of Americans to either choose a new health plan or make changes to their current health care coverage. This window starts on October 15th and runs all the way through December 7th, and any change you make or plan you will pick will take effect January 1st, 2021.
Okay, so what do I need to know about Medicare coverage right now?
You know, I think there's a couple of key things to know, and just Medicare itself is a little bit confusing. We have Original Medicare, which is Part A and Part B, with Part A being your hospital coverage and Part B being your medical coverage. This is provided by the federal government. We also have something called a Medicare Advantage plan, which is a combination of both Part A and Part B and has some additional benefits and resources. Lastly, there's something called a Medicare Supplement plan, and these plans help to cover some of the things that Medicare Part A and Part B don't cover, like co-insurances, co-deductibles, and other things.
Okay, what about beneficiaries? What or should they or could they be considering right now?
You know, I think the biggest thing to consider is your current health, your current cost, what plans network has your physicians, your hospitals, and your pharmacies involved with them.
Okay.
Additionally, don't forget to look at those Medicare Advantage plans and what some of those additional benefits are. There's sometimes some really nice things that would benefit you individually based on your healthcare status.
Excellent. Dr. Ostrom, how has COVID-19 affected, I know what it's affected, but the changes that we might need to be making, what should we be looking at?
You know, so many changes that have, affected the practice of healthcare in 2020. And one of those is actually telehealth and virtual healthcare services. So kind of when looking through kind of a plan, that might be I think that's a very important thing to kind of look at is kind of what, practices offer these services. As we know, COVID is here for quite some time to come. And then just finding the right plan that fits for you, and kind of you can go to Medicare.gov, and within the safety of your home, you can kind of look at a comparison of the different plans, again, finding the right fit for your needs. And needs have probably changed this year. Maybe finances have changed, your health benefits may have changed, and just what is now most important to you. And last year, virtual health and telehealth, that was just not a priority, but it is a big priority going forward.
Absolutely. We talk about it all the time. Now, what are some of your patients telling you? What are they asking you when it comes to looking at their Medicare plans?
A lot of them are looking at, the availability of kind of the telehealth and virtual health and just kind of expanded services. They're very specific as the, what if I get COVID? What do I do? Can you care for me? So all of these types of things can become really important to have all of those benefits. And behavioral health benefits is really important going forward and looking at that, because with the COVID 2020, pandemic that has occurred, behavioral health needs have increased.
Yes, yes, yes. Lots of things are going to be different next year. And luckily, we've kind of seen a little bit of what those changes might be. So it's super important to review everything right now. I want to thank both of you for joining us. This is really good information. And for our viewers, if you want to learn more about Medicare open enrollment with OptumCare Primary Care, you can call 1-866-910-4621. You can also visit the website. It's optumcare.com/Medicare 2021.